chemotherapy is something that needs to be considered when we're considering breast reconstruction. The reason it's important to consider this is that chemotherapy inherently weakens the immune system and decreases the ability of the body to heal wounds. Surgical wounds are created always when a mastectomy is performed and a reconstruction is performed. So generally, when someone is undergoing chemotherapy, we wait until at least a month after the chemotherapy in order to do the mastectomy and the reconstruction. That particular scenario is in the case of what is called neoadjuvant chemotherapy. Neoadjuvant chemotherapy is chemotherapy that occurs before a mastectomy. I, as a plastic surgeon, am never really a part of the decision making that relates to when a person is going to get chemotherapy, but I do need to play an important role in considering how chemotherapy will have an impact on breast reconstruction. And thus, if someone is undergoing neoadjuvant chemotherapy, I often like to wait at least 1 month after the termination, the last dose of that chemotherapy, for the patient to have the mastectomy and go on to have the breast reconstruction. And I should mention that 1 month is a guideline. 3 weeks sometimes is acceptable, and sometimes we wait up to 6 or even 8 weeks, depending on logistical issues and the patient's specific care plan. These kinds of decisions are always made in coordination with the breast surgeon who's going to be performing the mastectomy and the medical oncologist who is coordinating the chemotherapy. There are times where a patient needs to get chemotherapy after they have a mastectomy. Again, those are not the types of decisions that I make, but those are things that I need to consider. And often a patient needs to wait at least 1 month after they have had their surgery. Let's say it was a mastectomy and a reconstruction with a tissue expander or a reconstruction with a DIEP flap. They often need to wait 1 month in order to have chemotherapy in a safe way. Because remember, once again, chemotherapy can decrease the body's immune system function and decrease the body's ability to heal. And so after a patient has had surgery, again, we need to give the body 1 month to heal those wounds, to fight off any potential infection before they start chemotherapy.